in the start with that. Good morning, dear students. Today, I'll try to tell you something about the anatomy of the middle ear. In the last class, you have seen the uh, anatomy of the external ear and the diseases of the external ear. Now we go to the anatomy of the middle ear. And as you know, the external ear, middle ear, and the inner ear. This is the sequence. Now, the middle ear cavity is usually studied uh, along with the Eustachian tube, the middle ear cavity, the adytus, that is the passage which connects the middle ear cavity with the antrum, which is supposed to be the biggest air cell, and the antrum in turn is connected to the various air cells, which are the mastoid air cells. So this is called um, the middle ear cleft. So the middle ear cleft consists of the Eustachian tube, one end which is opening into the nasopharynx, and the other end into the middle ear cavity. Then you have the middle ear cavity, and then you have the adytus, that is the passage which is connecting the middle ear cavity to that of the mastoid antrum, which is a big air cell. And this air cell in turn is communicating with the various groups of air cells which are located in the mastoid cavity. Now, then we go to the embryology, the development. Usually, the arches there, the the facial arch, pharyngeal arches, the are described. Each arch consists of an outer ectoderm, the middle mesoderm, and the internal endoderm. Okay, these are the components for each arch, and each arch is separated from one another by outside from a small depression, which is depression or a notch, which is called the cleft. The outside is called the cleft, whereas from inside, that is from the endoderm, the cleft is called the pouch. This is what you should basically remember. So there is an ectoderm, there is a mesoderm, and then there is an endoderm. And a depression in the ectoderm component, which is a niche kind of a thing, that is called the cleft, whereas the same extension from the endoderm is called uh, the pouch. So these are the pharyngeal arches. Now the first arch is called the mandibular arch, and the second one is the hyoid arch. So that is the mandibular arch, and that is the hyoid arch. Now um, uh, the structures that are derived from uh, from from the ectoderm, endoderm, and the mesoderm. We'll try to go and see what are the structures in this middle ear cleft, which are derived from these arches. Now, if you see the Eustachian tube, as I told you, the middle ear cleft, tympanic cavity, the attic, mastoid air cells, they develop from the endoderm. Okay. Now that is the first pharyngeal arch there, and and this now this is the pharyngeal pouch. that is from the endoderm inside, and that is the sorry, that is the cleft from outside. Okay, so the Eustachian tube, tympanic cavity, attic, mastoid air cells are developed from the endoderm and from the tubotympanic recess, which arises from the first pharyngeal pouch, that is from inside. Whereas the malleus and the incus, there are three bones in the middle ear cavity: malleus, incus, and stapes. The malleus and the incus are derived from the mesoderm, that is the tissue which is in between the ectoderm and the mesoderm of the first arch, while the stapes, that is the footplate of the stapes, is developed from the second arch, except its footplate and annular ligament, which are derived from the otic capsule. Okay, so try to understand this. The malleus and incus are part of the first arch, whereas the stapes, that is the innermost bone, which is developed from the second arch, except the annular ligament, which is developing from the otic capsule. So that is in brief about uh, the embryology. Now we come to the Eustachian tube. As we know, Eustachian tube is the tube which connects the nasopharynx with the middle ear cavity. And in adults, this is about 36 millimeters long, and it has got two components. One is the bony part and the cartilaginous part. The cartilaginous part is the one which forms the inner two-thirds, whereas the outer one-third is formed by the bony part. Now, the Eustachian tube in a child is about 18 millimeters, and there are some changes that do occur in the Eustachian tube from the infant stage to the adult stage. And if you see the gross differences, now as you see the Eustachian, this is the cartilaginous part, and that is the bony part, and it opens into the middle ear cavity, um, by into the anterior wall, and the outside part, the it is usually described that the cartilaginous part, the cartilage is not completely surrounding the Eustachian tube, even in the cartilaginous part. So there is cartilage which is present in the superior and the lateral and the medial part. It is like that. Whereas the anterior inferior part, the anterior, posterior medially, it is all the posterior, that's the posterior part, and that's the medial part. That's the cartilage. Whereas anterior inferiorly, it is by the fibrous tissue and a pad of fat, which is called Ostman's pad of fat. So roughly, you just remember, Eustachian tube is a tube which has got two components. One is the cartilage and the bony part, and the cartilaginous part is the one where the cartilage is not totally surrounding the Eustachian tube, but is surrounding the anterior, the superior, and the posterior part. Whereas the anterior inferior part is there is a fibrous tissue and pad of fat. Eustachian tube is normally closed. It opens. There are two muscles which influence this. The one is the tensor palatini and levator palatini, which are in close association with the Eustachian tube. And so Eustachian tube normally is a closed tube. It's a closed tube. It opens when you swallow or when you blow the air, Valsalva method. So, and then immediately closes again. And we'll come to the physiology of the Eustachian tube, the function of the Eustachian tube later. But this is what basically you should remember. And the differences between the adult and infant is important because most of the infections that are present in the nasopharynx or in the nasal cavity, they travel via the Eustachian tube into the middle cavity. That's the commonest source of infections. So Eustachian tube uh, is important because the infections travel from the nasopharynx into the middle ear cavity through this. So if you take up, there are some factors which predispose for this infection to occur more common in children than in the adults because of the differences of these Eustachian tube in child as well as the adult. In the child, the Eustachian tube is small, okay, because the bony part is not developed. Eustachian tube is about 18 millimeters and it has got an angle with the horizontal, which is only 10 degrees. That means it's almost horizontal. Then the other difference is it is wider. Okay, so it is wider, shorter, and more horizontally placed. That's why infections can travel in a child very frequently from the nasopharyngeal end into the middle ear cavity. That is the uh, factor which influences the infections of the middle ear cavity. And in the adults, it's longer and it's more angulated and narrow. Okay, and if you see the Eustachian tube again, uh, between the bony and the cartilaginous part, there is a small area which is constricted, which is called the isthmus, which is the narrowest part of the Eustachian tube. So, this is what briefly you should know about the Eustachian tube, that it connects the nasopharynx with the middle ear cavity, and it has got the bony part and the cartilaginous part. The cartilaginous part is partly encircling the Eustachian tube and partly by the fibrous and the pad of fat antero-inferiorly. And Eustachian tube is normally closed, but it opens when you swallow and or when you blow, which is called the Valsalva technique. And then there are some differences which you need to understand between the child and the adult Eustachian tube, because these factors are the ones which influence the infection spreading from the nasopharynx into the middle ear cavity very easily in a child, because the Eustachian tube is smaller and it is wider and more horizontally placed. So with this knowledge of the Eustachian tube, we'll that is the blood supply of the Eustachian tube, ascending pharyngeal artery, middle pharyngeal artery, and artery of the pterygoid canal. Now veins drain into the pterygoid plexus. Now, then we come to the tympanic membrane. That is the one of the walls of the middle ear cavity. Middle ear cavity is like a room, like a roof. It has got a roof, which has got a floor, a lateral wall, a medial wall, and anterior and posterior wall, just like a room. So one of the walls of this room is by the tympanic membrane, and tympanic membrane, the details of which have been explained to you in the last classes. And it has got two components: the pars tensa and the pars flaccida. The pars tensa has got it is called because the pars tensa has got the middle fibrous layer, which in the periphery thickens to form the tympanic annulus, which sits into a small groove in the bone there, and it is tense. So that is called the pars tensa. and the other part is the pars flaccida, which is above the anterior and anterior and posterior malleolar folds. The pars flaccida, the fibrous component of the tympanic membrane. As you know, the tympanic membrane has got the three layers: the outer skin layer, squamous layer, the middle fibrous layer, and the inner layer. So, in the pars flaccida, the fibrous layer is not so well developed, or it's not present, and only two layers, the parts, the skin and the mucous membrane. And the other difference is the fibrous tissue, as in the pars tensa, the fibrous tissue is absent, so there is no tympanic annulus which sits into the groove of uh, the bone, so the temporal bone. And so there is a small depression which is called notch of Ribinus. Notch of Ribinus. So this is about the tympanic membrane briefly, and just to recapitulate. And then we go to the um, yeah, this is the same thing explained. Tympanic sulcus in the temporal bone. The fibrous annulus sits. The annulus is deficient superiorly in the pars flaccida and is called the notch of Ribinus. Now, the nerve supply of the tympanic membrane is the posterior superior part, or posterior half of the lateral surface is by the uh, half of the lateral surface is by the auricular branch of the vagus nerve, that is the 10th nerve, whereas the anterior part is supplied by the auricular temporal, which is a branch of the mandibular division, that is the 5th nerve, whereas the mucous membrane inside is supplied by the glossopharyngeal nerve. So there are three nerves supplied to the tympanic membrane. One is posterior, is the vagus, and the anterior is by the auriculotemporal nerve, which is a branch of the mandibular division of the trigeminal nerve. So, and inside the mucous membrane is by the branch of the glossopharyngeal nerve, which is otherwise called Jacobson's nerve. That is about the tympanic membrane. And the tympanic membrane, as I told you, is the one of the lateral walls of the uh, tympanic cavity. So the tympanic cavity has got, as I told you, it has got a roof, it has got a floor, a medial wall, anterior wall, and posterior wall. Let us try to understand all the various walls of this tympanic cavity, and then we go to the contents of these, the contents of the middle ear cavity, how they are disposed, and how they help in conducting the sound waves which strike the tympanic membrane, and how they are conducted via the middle ear into the inner ear cavity. So the tympanic cavity is divided, that is the cavity is divided into three components: epitympanum, the mesotympanum, and the hypotympanum. Okay, as the description given here in the diagram, the from the part which is corresponding to the tympanic membrane, the part which is corresponding the tympanic membrane, uh, yeah, corresponding with the tympanic membrane, that is called the mesotympanum, and anything above that is the above that that is the epitympanum, and then down is the hypotympanum. So that is how the tympanic cavity is divided. The corresponding area where there is the tympanic membrane, that is called the mesotympanum, and above is the epitympanum, and below is the hypotympanum. Now, as I told you, the various walls of the tympanic cavity. The roof, the posterior wall, the anterior wall, the medial wall, the floor, and the lateral wall. So here, what you are seeing is the medial wall because the lateral wall has been removed. Or so let us see what are the important structures which are in relation to the um, various walls. Now, the roof is a thin plate of bone called the tegment tympani. This tegment tympani is the one which which separates the tegment tympani. That's the roof. Just look at the roof. Tegment tympani, which separates the medullary cavity. It also extends further down or backwards uh, into the tegmen antrum, that is the above the antrum, also the middle mastoid cavity. And this separates this thin plate of bone is part of the temporal bone, which separates the medullary cavity with the middle cranial fossa. As you know, the cranial fossa, the anterior, middle, and posterior cranial fossa. So the middle cranial fossa, it is separated. The medullary cavity is separated by the thin plate of bone, which is part of the temporal bone, which is extending just above the medullary cavity, the edictus, as well as the antrum, the mastoid antrum. So that is called the tegmen tympani, tegmen antri, which continue backwards. So that is it also extends posteriorly, roof, edictus, and antrum. It separates the tympanic cavity from the middle cranial fossa. This is what you should know. Then we come to the floor. The floor of the medullary cavity is separated from the jugular bulb. You have the internal jugular vein. The internal jugular vein, if you trace it upwards, the internal jugular vein just at the floor of the medullary cavity. It forms a bulb-like thing, which is called the jugular bulb. And this jugular bulb further continues. Actually, you should trace it from the venous, from the reverse side. The superior sagittal sinus, the transverse sinus, and the sigmoid sinus. It comes out through the jugular foramina. It comes out through the from the cranium, jugular foramina and it is in close relation to the medullary cavity. And as it exits from the jugular foramina, there's immediately you have the jugular bulb, which is in relation to the floor of the medullary cavity. So the important structure that you have is the jugular bulb, which is continuation of the jugular, sigmoid sinus, and then further continues as the internal jugular vein. And that is as far as the jugular, the floor is concerned. Then we go to the next, that is the floor. Now, in the floor, there is a small aperture, small opening through which the 10th, 9th, the glossopharyngeal nerve extends. As we told, the Jacobson's nerve. It comes into the medullary cavity through the floor, piercing there's a small aperture through which the glossopharyngeal nerve enters the medullary cavity. That's from the floor. Then that is the importance of the floor. Then we come to the anterior wall. The anterior wall, see, this is the anterior. This is called the anterior wall, and this anterior wall is in relation to the carotid artery. You have the carotid foramina, and which is and that is in relation to the anterior aspect of the medullary cavity. And this internal carotid artery, uh, by its presence, the anterior wall is otherwise called as the carotid wall. The anterior wall is otherwise called the carotid wall, whereas the floor is called the jugular. And the carotid artery, the carotid wall, which is otherwise the anterior wall, has got two openings in the anterior wall itself. One is an opening for the pharyngotympanic tube or the Eustachian tube, as we mentioned, which connects the nasopharynx with the middle cavity. That is the pharyngotympanic tube. And then, so just above that, that is the Eustachian tube, which is opening into the anterior wall of the middle cavity and communicates with the nasopharynx. Whereas just above the Eustachian tube, there is another canal which is for the tensor tympani muscle. The tensor tympani muscle is the muscle uh, which there is a shelf-like uh, partition between the Eustachian tube and the tensor tympani, and the tensor tympani muscle comes out and ultimately enters the anterior wall most medially, anterior wall, and pierces that, and then it is inserted into the handle of the malleus, the neck of the malleus. So that we'll see that, and that is as far as the anterior wall is concerned. The anterior wall, lower part, it is the carotid artery, as we said, carotid artery. That's why it's called the carotid wall. And you have the Eustachian tube, and that is the canal for the tensor tympani muscle. Canal for the tensor tympani muscle. And yeah, then we go to the lateral wall. The lateral wall is there are several structures which we need to understand. In the lateral wall, the most prominent part, lateral wall. Sorry, lateral wall is the major part is by the tympanic membrane, and above the tympanic membrane, that's the epitympanum. It is the bone. It's the temporal bone. It is the bone which forms the lateral wall. So major part of the lateral wall is formed by the tympanic membrane, and superiorly the epitympanum. There is a small projection of this temporal bone. Sure, let me see if I can show you that. So the lateral wall is partly by the tympanic membrane, and also the projection that forms the lateral wall of the tympanic cavity, and small part component in the hypotympanic. Then these are the structures that are present. This is how the lateral wall is formed, and the medial. Then we come to the medial wall, which is wherein we need to understand certain structures. And this medial wall is the one which separates the tympanic cavity from the that's the middle ear from the inner ear. Okay, and the structures that are present are, one is the promontory. The promontory is the one which is the bulge which is formed by the basal turn of the cochlea. As you know, the cochlea has got the 2.5 turns, like a snail shield, and it has got the first turn is formed by the promontory, the bulge that is formed. That is called the promontory. And this promontory, just behind in the location posteriorly, there are two openings One opening is the oval window, the other one is the round window. And the just above the oval window, there is the bony canal, which lodges the facial nerve, the tympanic part of the facial nerve. And just above that, posteriorly itself, just above that, there is a lateral semicircular canal. There are three semicircular canals: the lateral or horizontal semicircular canal, the posterior and superior. These are the three semicircular canals which are perpendicular to each other, which are responsible for the balancing mechanism, which is the second component of the uh, ear, the function physiology of the hearing as well as the balancing. So the horizontal semicircular canal is just above the facial nerve canal. And there is another small projection which is called the process cochleiformis, which is nothing but a small shelf-like projection which is coming from the medial wall of the middle ear cavity superiorly. And it's like a concave, just like that. And the tendon, that is this tensor tympani tendon, as it comes from the just above the Eustachian tube, enters the anterior wall, and then it hooks around that small shelf, and then is inserted into the neck of the malleus. So these are the structures. Promontory is nothing but the basal turn of the cochlea, the bulge produced by the basal turn of the cochlea. Second, just behind that, let me see if I can show you that. Yeah, yeah. This is how it is. The that is the promontory. That is the promontory, and just above and posteriorly, there is a depression which is called the oval window, and this oval window is covered by the foot plate of the stapes. That is the innermost bone. Okay, the ossicles, and okay. Now that is the stapes, and so this is the promontory, the bulge. That is the promontory. That is the oval window, and that is the facial nerve. That's the facial nerve, the tympanic component of the facial nerve, or the horizontal, and that is the horizontal semicircular canal. The horizontal semicircular canal, and that is the facial nerve. That is the oval window, and just below that is the round window. Okay. So these are the structures uh, which are important structures that are present in the medial wall of the middle ear cavity. That is, the promontory, once again, is the basal turn of the cochlear bulge, and the round window, which is covered by the secondary tympanic membrane. That's the oval window, which is covered by the foot plate of the stapes. That is the anterior crus, and the posterior crus. That's the neck and the head, and that is the tendon which is attached to the neck. And and then you have the facial nerve, the horizontal part, and then the and then it takes a turn. The facial nerve takes a turn, the vertical part, and just above that is the horizontal semicircular canal, the bulge produced by the horizontal semicircular canal. And once again, just try to recapitulate. That is the tensor tympani muscle, and that is the stapedius muscle, which is coming through the bony pyramid, and that is the Eustachian tube, which is opening anterior-inferiorly, and you have the internal carotid artery, which is in relation to the anterior wall. That is why it is called the the carotid wall. So these are the structures which you need to slowly understand and get the orientation. This is the anterior wall, and because the carotid is there, it's called carotid wall. which has got these openings, that is Eustachian tube opening, and the tensor tympani muscle, and as it comes into the middle ear cavity. So these are the structures that are present in the medial wall of the uh, middle ear cavity. And of course, the description oval window just behind and above the promontory, as you have seen, it's a kidney shaped opening which is about 3.25 millimeters and 1.75 millimeters wide. That is the oval window description of the oval window. Then uh, in the bone, this is how you see. All this time you have been seeing the diagrammatic representations, but this is how it looks really. Okay, and this is the promontory. This is the promontory. That's the Eustachian tube. Okay, that's the Eustachian tube, and this is the jugular bulb. That is the floor of the middle ear cavity, and that is the stapes, and that's the footplate of the stapes, and then that is the oval window, and just above the oval window, that's the round window, sorry, and that is just above the oval window, you have the facial nerve, and just above that there is the lateral semicircular canal which is present. This facial nerve, it travels in the horizontal part, and then as it comes into the mastoid, the posterior wall, it becomes the vertical component. Okay, that is the facial nerve. That's how the facial nerve works. And this is the shelf, small projection, as I told you, uh, from where the tensor tympani tendon hooks. That is called the processus cochleaformis. So these are the structures which you have to uh, get the orientation. Processus cochleaformis, the small projection for the tensor tympani, and lateral semicircular canal, facial nerve, the oval window covered by the footplate of the stapes, the round window covered by the secondary tympanic membrane, and the promontory, which is the basal turn of the cochlea, the bulge produced by the basal turn of the cochlea, and that is the eustachian tubal opening. Okay, and that's jugular bulb. This is how it appears in the temporal bone. This is another picture which also gives us um, the real picture of the middle ear cavity. Now, that is the oval window, the anterior, that is the stapes, the anterior crus, and the posterior crus. That is the tendon which is getting inserted into the neck of the stapes. And just above that is the horizontal, the horizontal part of the facial nerve, seventh nerve, and so that is the oval window, and that is the round window which is covered by secondary tympanic membrane. Secondary tympanic membrane. Okay. Then the facial nerve canal, otherwise called the fallopian canal, runs above the promontory, as I have shown you, and oval window, and anterior-posterior direction. And I told you about the process cochleaformis curve projection, a bone concave anteriorly, which houses the tendon of the tensor tympani muscle as it turns laterally to insert into the handle of the malleus. I think there is another picture. Let me see. Yeah, this is how it is. Once again, the tensor tympani muscle, and that's the facial nerve, and there it turns outside and gets inserted into the malleus. So once again, similar, same structures. That is the eustachian tube, the fallopian uh, uh, tensor tympani muscle, the facial nerve, the horizontal semicircular canal, and then you have the promontory, and you have uh, the round window. That's the whole window covered by the foot plate of the stapes, and that's the round window. Then, um, okay, there are, as I told you, the oval window. After it crosses the oval window, there's another anatomical landmark. There's certain landmarks which are which form as a guide to the facial nerve location. And these landmarks is the first one is the process cochleariformis. The process cochleariformis, uh, that's the area. And then you have the whole window. The facial nerve travels like that. There's next landmark is the fossa incudis. Fossa incudis is the small depression that is present, into which the short process of the incus, the short process of the incus is attached with a ligament. Okay, and then from there the facial nerve takes a vertical bend downwards. In the This is called the mastoid. The posterior wall of the middle cavity is otherwise called the mastoid cavity. So in the mastoid segment, the facial nerve becomes vertical and then comes down, and then ultimately at the stylomastoid phenomena, it comes out through the temporal bone, comes out through the bone. And before it comes out, at the geniculate ganglion, this is the ganglion wherein the facial nerve, as it comes out, comes through the internal acoustic meatus, labyrinthine part, and then when it comes to the middle ear cavity, there is a small ganglion, and from there there's a nerve which comes out, which is called the greater superficial petrosal nerve. Then there is something which is in the bone itself. Then you have the as it is traveling in the middle ear cavity, the first branch that it gives is the facial nerve gives is the uh, nerve to the stapedius muscle. This is the stapedius muscle, which is in the pyramid, small, comes out through that pyramid and then inserted into the neck of the stapes. Okay, that is the neck of the stapes. That is the articular surface of the stapes. So, so that is the other the branch which supplies branch of the facial nerve which supplies the tensor, the stapedius muscle. And then there is another nerve before it emerges out into the external through the stylomastoid foramina. It gives up another branch which is called the chorda tympani. And this chorda tympani, once again, it travels in the mastoid segment of the bone, and then comes into the middle ear cavity, travels in between the malleus and the incus, and and comes out through the anterior wall uh, by a small fissure called tympanic fissure. And as the chorda tympani comes out, it joins the lingual nerve. It joins the lingual nerve, and through the lingual nerve, it supplies the submandibular uh, lymph nodes, the submandibular, the secretomotor fibers. It has got the secretomotor fibers as well as the special sensation of taste. So the chordae has two components. I mean, there are two aspects which we need to understand, that they carry the secretomotor fibers, the parasympathetic secretomotor fibers, and also the they also carry the special sensation of taste. Okay, so that is called the chorda tympani. Then, yeah, the dome of the lateral semicircular canal, as we have seen, that is the lateral semicircular canal, and it projects just above the facial nerve. Then the posterior wall. Then we come to the posterior wall. So we have seen the roof, which separates the middle cavity um, from the middle cranial fossa. The anterior wall, which is the carotid wall, the posterior, the floor by the jugular bulb, and the lateral wall by the tympanic major part by the tympanic membrane, and we have studied the medial wall. Now it is the posterior wall. The posterior wall, if you take from above, there is a small passage which connects the middle ear cavity, which connects the middle ear cavity. Let's see. Sure. Now that's the tympanic membrane. Try to get that, which is the lateral wall, and lateral wall is partly formed by the bone of the epitympanic area. And the this is the muscle, the tensor tympani muscle, and so that is the lateral wall, and the roof, of course. Then we have the in the medial wall, that is the promontory, and the malleus, the incus, and that is the, as I told you, the fossa incudis, where it is the short process of the incus is attached by a small ligament, and that is uh, the incus, the long process of the incus, and then the lenticular process. Then it articulates by a synovial joint with the stapes, and that's the neck of the stapes, into which the small, the muscle, the stapedius muscle or tendon of the stapedius muscle is inserted. That is the anterior crus, and that is the posterior crus, and that is the oval window. So this oval window, that is the footplate of the stapes, which is covering the oval window. Okay, so this is the in the attic, from the attic, from the epitympanum. There is a, there you see that passage. That passage is called the editus, and this editus is the one which leads the, or which connects the middle ear cavity to the mastoid antrum, which is the biggest air cell which is constantly present. That is the editus, and that is the editus ad antrum. Okay. Now, fossa incudis, I told you, short process of the incus, where it's attached there, and the bulge produced by the lateral semicircular canal, which we have already seen. The pyramidal eminence for stapedius tendon. See, that is the pyramidal eminence. Let me see if I can show you in a better picture. Yeah. Now that is the pyramidal eminence. That is the small pyramidal eminence which is present in the posterior. This wall is called the posterior wall or the mastoid wall. So that one thing that we have seen is the fossa incudis, and this is the pyramidal process. I'll show you that once again. That is the pyramidal process. Then the fossa incudis I have shown you. This is the incus. Incus has got a short process, and that is the tendon, and that is the area where it is attached. That is called the fossa incudis. Okay. So then the bulge produced by the lateral semicircular canal, which you have seen, the pyramidal eminence of the stapedius tendon, the bulge produced by vertical part of the facial nerve. Vertical part of the, as I told you, the horizontal part becomes the vertical part. Then you have the sinus tympani. This is one thing which you have to understand. In the posterior wall, because at, if that is the posterior wall thickness, and in between there is the pyramidal eminence, which separates the posterior wall into two pouches, into two spaces. The space which is outside towards the lateral side is called the facial recess. The one which is medial is called the sinus tympani. Try to get that picture. In the posterior wall, there is a shelf-like thing in between. That is the pyramidal eminence. The pyramidal eminence is the one which separates the posterior wall into two cavities, two sinuses. The one which is lateral from the pyramidal eminence to the outer wall of the mid layer cavity, that is called the facial recess, whereas the one which is medial to the pyramidal process is called the sinus tympani. So these are these things which you have to slowly get accustomed to and get a picture of these. So we have read about the eritus. It's the connection between the posterior wall from the posterior wall of the epitympanic and connects the uh, antrum, mastoid antrum, which is the big air cell. The fossa incudis, short process of the incus is attached there. That is the short process of the incus, and that is the eritus. And that is the pyramid, and that is the stapedius tendon. And the bulk produced by vertical part of the facial nerve, vertical part of the facial nerve. See, get this orientation. This is important. The horizontal part of the facial nerve and the vertical part of the facial nerve. So, and sinus tympani and facial recess. Okay, uh, get familiar with these names, and the posterior wall is wider above than below. Okay, it's like that. The upper part, a large irregular opening, the eritus, as we have described. Below eritus is the fossa incudis, just trying to repeat. And below the fossa incudis and the medial to the opening is the chorda tympani is the pyramid, a small hollow conical projection with its apex pointing in anteriorly. That's the pyramidal process. This houses the stapedius tendon, the muscle, and comes out through there's a small aperture at the tip of the pyramid through which the tendon comes out and then inserts into the posterior aspect of the head of the stapes. Then the canal within the pyramid curves downwards and backwards to join the descending portion of the facial nerve. So that is another landmark for the location of the facial nerve. Now, the facial recess is another recess which is important because in the uh, cochlear implants, the implant uh, is uh, is inserted. It is fixed in the mastoid cavity, and the connection uh, is brought into the middle ear cavity without the tympanic membrane, without damaging the tympanic membrane. So there is a space between as I told you, the horizontal part of the facial nerve and the mastoid segment, the vertical part, and the chorda tympani as it comes out into the middle ear cavity again. So this space in between is called the facial recess. So from the mastoid region, you can come into the mastoid and then drill the mastoid, the posterior segment, between the facial nerve and the chorda tympani, and then you come into the middle ear cavity. And this is the approach which is important for uh, the cochlear implant. So that is what the facial recess is. That is the importance of the facial recess. Now this is once again in the bone that is shown. So this is the lateral semicircular canal, and just below the lateral semicircular canal is the facial nerve, the horizontal part, and that is the vertical part of the facial nerve. Okay, and that is the oval window. That's the foot plate, the stapes. That is the incus once again. Okay, and that is the, and this is the round window. This round window which is covered by secondary tympanic membrane. So the chorda tympani must be, this must be the chorda tympani. See, it's a little displaced. Okay, that is the chorda tympani, which is coming from the facial nerve before the facial nerve emerges out of the stylomastoid foramina. Now, so the space in between is called the facial recess. So the cochlear implant, it comes like that, and then some people do a small opening here, and which is called the cochleostomy, and through which uh, the electrodes of the cochlear implant are introduced into the scala tympani. Um, so basically, you should understand this. We are once again um, repeating the horizontal semicircular canal. That's the bulge. Just below that is the horizontal semicircular canal, so horizontal part of the facial nerve, becoming the vertical part, and that is the incus, that is the lenticular process, and the stapes, the uh, and the whole window is covered by that, and then that is the bulge, which is the promontory, and just behind that is a small opening, which is the secondary, covered by the secondary tympanic membrane. That is the round window. Okay, so, and that is the facial recess, that area is. So this is how you approach the middle cavity through the facial recess, and put the electrodes into the middle, into the inner ear. That is the, now sinus tympani is something which you have to, as I told you, in the posterior wall of the mastoid segment, the pyramid is the one which occupies the in the middle. Anything lateral is the facial recess. Medial is the sinus tympani. So sinus tympani gains its importance because the cholesteatoma sometimes, the cholesteatoma, the disease, is the one which goes into the sinus tympani and lurks there, and that is the area you can you have to particularly understand the anatomy and try to remove that cholesteatoma from the that pouch like thing, the sinus tympani. Otherwise, that is the area where the infection can be left over because it's a little small space which is like a pouch. Okay, so that is as far as the sinus tympani. And what does he give? The it abates direct surgical visualization during surgery site for cholesteatoma recurrence, because we leave it. Now, the contents of the middle ear cavity. The first and foremost content of the middle ear cavity is air. Let me show you the middle ear cavity. Ah, so this is how the middle ear cavity. Okay, the middle ear cavity. It is the most important content of the middle ear cavity is the air. It's an air-filled cavity of the temporal, in the temporal bone. And this in turn is connected to the via the anterior wall into the via the Eustachian tube into the nasopharynx, and the nasopharynx, the Eustachian tube is the one which equalizes the pressure between the outside atmosphere and the middle cavity, which is essential for the tympanic membrane to function properly. Okay, so the major content is the air. Then you have three bones, which are the malleus, the incus, and the stapes. And we have been going through the various parts of these. The malleus has got the head, a lateral process, an anterior process, and the handle of the malleus. And there's a small bulge there at the tip, which is called the umbo. So this is what the malleus is. The malleus has got a head, the neck, the lateral process, the handle of the malleus, and the anterior process. The anterior process to which the anterior malleolar ligament is attached, and uh, that is the malleus. The incus has got a body which is uh, that is the body which is present in the epitympanum, and even the head of the malleus is in the epitympanum. Then it has got a short process and it has got a long process. The long process bends medially there, that is called the lenticular process, which articulates with the uh, head of the stapes. Okay, and stapes has got the head, the neck, and the anterior crura and posterior crus or crura and the foot plate of the stapes. This is in general the structure of the three bones, the malleus, incus, and stapes. So the main content is the air, and you have three bones. These are the three bones are malleus, incus, and stapes. Then you have the nerves. That is the facial nerve, which is of course running in the uh, facial nerve, which is running in the medial wall of the middle ear cavity. Then the vertical part in the mastoid cavity. Then you have the nerve branch of the facial nerve, which supplies the stapedius muscle. Then you have the chorda tympani, which carries the special sensations, the taste sensations from the tongue, and also the secretomotor fibers for the uh, submandibular and sublingual glands. And there is another nerve which is a branch of the glossopharyngeal, which forms a plexus there on the promontory. That is the uh, glossopharyngeal nerve plexus on the promontory, and the Jacobson's nerve. So these are the nerves. The nerves are the facial nerve itself, the branch to the stapedius, and the chorda tympani and the Jacobsons. These are the nerves which are present in the middle ear cavity. Then uh, the muscles. You have seen the muscles. The muscles are the tensor tympani and also the stapedius muscles. So these are the structures that are present in the middle ear cavity. So air, major component, the three ossicles, the malleus, incus, and stapes, the two muscles, the tensor tympani and the stapedius muscle, the two nerves, the chorda tympani and the tympanic plexus, and of course the small, uh, yeah, the two nerves, the chorda tympani and the tympanic plexus, and the nerve to stapedius muscle. Then the mucosal folds and the ligaments, and of course the blood vessels which supply the middle ear cavity. And these are the ossicles. The various parts have been described here. Uh, that is the malleus, incus, and stapes, how they are aligned there. This is another picture, similar one. where you can see a little clearly the malleus and the head of the malleus, anterior process, lateral process, the handle of the malleus. The handle of the malleus is a part of the tympanic membrane. It is embedded in the tympanic membrane between the squamous layer and the mucosal layer in the fibrous layer of the tympanic membrane. So that is what is uh, the muscles of the middle ear cavity. There are two muscles: the tensor tympani and that is the tensor tympani and the tendon, and that is the stapedius and its tendon. This is inserted into the malleus, and this is inserted into the stapes. So same thing once again, and the caudate tympani nerve. I think description is given here. Let's see. Let's try to follow the nerve. A branch of the facial nerve, that is the vertical segment, mastoid segment, and the facial nerve comes out, the caudate tympani nerve comes out like that, comes into the middle ear cavity, runs between the handle of the malleus and the handle of the malleus and the long process of the incus, and then comes out and exits through the skull by a petrotympanic fissure, and then comes uh, into the neck, and then joins the lingual nerve, through which it the taste sensations as well as the secretomotor fibers to the submandibular and sublingual glands. So this is what is described here. Then the tympanic plexus, which is formed by the tympanic branch of the glossopharyngeal, which is otherwise called the Jacobson's nerve. Okay, and yeah, and this is the one which also lining the tympanic cavity, Eustachian tube, and mastoid antrum and air cells. The plexus also provides branches to the join the greater superficial petrosal nerve and lesser petrosal that contains all parasympathetic fibers of the glossopharyngeal nerve. So that is what. And if you see the mastoids, if you see the mucous membrane of the middle ear cavity, it is continuous with the uh, nasopharynx, the respiratory epithelium, pseudostratified ciliated columnar epithelium. Through via the Eustachian tube, it comes into the middle ear cavity, and middle ear cavity as such is also anterior part is the same mucous membrane is present, but as it goes posteriorly, posterior part of the mastoid, posterior part of the tympanic cavity, they become cuboidal, and same the cuboidal epithelium is continuing lining the mastoid air cells, mastoid antrum, the adytus, mastoid antrum, and the air cells. Whereas anterior-inferiorly in the tympanic cavity, anteriorly it is the respiratory epithelium which is continuous with the uh, via the Eustachian tube from the nasopharynx, which is otherwise called the respiratory epithelium. So that is, and then we come to the mastoid antrum, which is biggest and constantly present cells. There are three variants of the mastoids by their developmentally. One is cellular mastoids, where you have plenty of these air cells that are present and in communication with the mastoid antrum. Okay, and these air cells are described uh, by the name and by the structure to which they are in relation to. Suppose there are some cells which are in relation to the labyrinth, that is the medial side. Medial side is the labyrinth. So they are called perilabyrinthine cells, which are related to the facial nerve, perifacial cells, which are present in the tip of the mastoid, the tip cells. The around the antrum, they are called periantral cells. Okay, and there is the sigmoid sinus there, which is the medial wall, medial and posterior wall, and that they are called the perisinus cells. So the cells the mastoid air cells are honeycomb-like cells which are present in the mastoid part of the bone, the temporal bone, and also the petrous part of the petrous extension. And these are uh, named after the important structures with which they are related to, like the labyrinth, the facial nerve, perifacial, the about around the antrum, periantral cells, sinus cells, the dip cells. So that is how they are named. These are called the uh, and the mastoid antrum. um, there are three variants that are described. One is the cellular, where you have plenty of cells. The other one is the sclerotic. You have the only the antrum and very scanty air cells, which are honeycomb-like cells. Then biomedia in between, they're hypocellular. Okay, so the three variants that are present, and these are cellular, mixed, as well as the sclerotic. So that is about the. This is once again same picture. That is the middle ear cavity. That's the Eustachian tube. That's the middle ear cavity. That the epitympanic, small connection via the adytus into the mastoid antrum and various antral cells. And that is the horizontal semicircular canal, and that is the posterior semicircular canal. Posterior semicircular canal. Superior will be somewhere there. Superior semicircular canal. And this is the sigmoid sinus. That is, sigmoid sinus is nothing but the intracranial transverse sinus continues as the sigmoid sinus, and then it's a venous channel, so it contains vein, and then comes out through the jugular foramina, and it is in relation to, here jugular bulb, which is in relation to the floor of the middle ear cavity. Okay, and there are certain landmarks that are described, which is called the McEwen's triangle, which is formed by a small projection of which is present in the posterior part of the external artery canal, Bony, and a tangential line drawn to the external artery canal, and there's a crest called supramastoid crest. So the bone or the area which is uh, bounded by these three, which is called the McEwen's triangle, it's a landmark for the mastoid antrum. If you drill into this, uh, then you get the mastoid antrum, which is the biggest air cell, which in turn communicates with the adytus into the middle ear cavity. So that is what is the McEwen's triangle. Then the mucosa of the middle ear cleft, as I told you, mucous membrane from the nasopharynx continues via the Eustachian tube into the middle ear cavity, and the continues into the mucous membrane. But the anterior part is the respiratory tract, which contains cilia, whereas the posterior part of the middle ear cavity and the adytus and the antrum and the air cells, it is the cuboidal. So that is what is the lining of the middle ear cavity. Then the blood supply is from the middle ear by the two main arteries, the anterior tympanic branch of the maxillary artery and the stylomastoid branch of the posterior auricular artery. Okay, and the venous drainage is from the into the pterygoid venous plexus, and the lymphatic drainage, the middle ear retropharyngeal, and the parotid nodes, the Eustachian tube, once again into the retropharyngeal group of nodes. Facial nerve is an important structure because any dissection that we or any surgical treatment that we have to perform in this region, facial nerve is the seventh cranial nerve, which is important because it is the one which supplies the facial muscles of facial expression, and expression is the most important component uh, of our uh, of our success in life. So If the expression is not proper, then the quality of life comes down. And so that is why the facial nerve is given so much of importance to the so much of importance, and we need to understand the complete course of the facial nerve. And these are the dimensions which are given, that as you keep basics, once you are aware and familiar, then we can go into these further details how the um, facial nerve, various branches, and how to identify the facial nerve course. And surgical marks, landmarks for the facial nerve are important, because that is how we can uh, trace the facial nerve even when there is a disease. Thank you, and go through these uh, pictures once again. Try to understand the general orientation of the middle ear. Basically, you should understand middle ear is not studied as it is as the middle ear, but it is called the middle ear cleft, which consists of the Eustachian tube, and which consists of the Eustachian tube, the Eustachian tube, which connects the middle ear cavity, and then how the middle ear cavity is divided into the spaces, the mesotympanum, epitympanum, and the hypotympanum. How the epitympanum is connected by a small passage via the editus into the antrum, which is the biggest air cell, and that in turn, the antrum in turn is connected to various groups of air cells, which are like honeycomb, and they are the ones which uh, are in connection with the antrum, and the entire um, all these structures together are called the middle ear cleft. Okay, let's meet in the next class. Ah, just, stream.